Turkana County is among the areas in Kenya that witnesses frequent insecurity challenges which disrupt service delivery and community outreaches.
Some places in our county are bordering the three countries. So the issue of cross-border, when there is drought like this, they move from where the services are and they live very far from where these vaccines cannot be found.
Plus, climate change-induced issues like drought and food insecurity have fueled the cases of zero-dose children.
The county government is planning to make sure that areas that do not have health facilities, they construct health facilities for the service to run. But meanwhile, as they do that, we can solve that issue by making sure that the services reach to the people.
High illiteracy levels, harsh weather patterns and rugged terrains have made it difficult for communities living in the hard-to-reach areas of Turkana County to both access information and connect with health workers that would offer them essential services like immunization.
We need to have regular joint support supervisions to make sure that we have known the bottlenecks that we have, and at the same time we also want to continue training the health workers, giving them the new updates and making sure that they are able to have the updated information about vaccination.
In addition, their nomadic lifestyle can cause them to miss overall government services, including health provision and vaccination.
We want to partner with the CHVs, the community people who are helping in health activities. They are the people that we want to use so much to make sure that we are able to get those who are not vaccinated, and those who have defaulted from the vaccination, we will be able to identify them and encourage them to come to finish their doses.
Lack of immunization services have been linked to increased cases of infant and child mortality, and families living in hard-to-reach areas incurring a lot of resources to travel to main urban centers in search of medical treatment for their ailing children. But today, it is also the epicenter of a silent crisis. Here, the decision to delay a vaccine isn't just a parent's preference. It is often a matter of geography, conflict and survival.
Tangu nilete apate hiyo matibabu, hajawahi pata shida yoyote. Na paka nikaleta dawa ya mwaka moja na miezi 6, na ngoja tena kumleta ya mwaka 2.
A decade ago, Turkana had a full vaccination coverage of 62%, but according to the 2022 Demographic Health Survey, the number has plummeted to just 29%. Today, the county government reports that 60% are fully immunized, but this still leaves a massive gap. 1.4% of children here are zero dose, meaning they have never received a single vaccine in their lives.
There are some children who are in hard-to-reach areas. These places, we have no facilities nearby, and so they will require outreaches for the health workers to reach there so that they can vaccinate these children. So most of them miss this because we do not have regular and routine outreaches that will make these people who live in hard-to-reach areas can be vaccinated. We are encouraging our community to make sure that they attain the antenatal services, and then they also are able to get skilled deliveries at the hospital. When they are delivered at the hospital, they will be able to get their first doses of vaccines, and at the same time we will encourage them to continue ensuring that they get the second doses and they complete the doses.
These children are completely naked to diseases, but delay has a price. Research shows that delayed schedules don't just hurt the individual child, they clog the healthcare system.
We used to report a lot of diarrhea cases in this county, but immediately when the community started making sure that their children are vaccinated, now there's minimal diarrhea cases because there's a vaccine that prevents diarrhea diseases.
Closing the immunization gap requires a global effort, with governments, partners and local leaders investing in primary health care and community workers to ensure every child gets vaccinated.
Advocacy, sensitization is required to make sure that everybody is able to come for this vaccination, even within their reach, because there are some who are staying even within the facilities and maybe their children are not vaccinated. So we need this knowledge to reach every child, to reach every parent, so that they can be able to use these services.
Even those community mobilizers need to be motivated, so that at least when a motivated people can work with a lot of energies. And that's synergistic. When we work together synergistically, we can enhance the immunization and reduce the zero dose.
And that overall healthcare is strengthened. Before they clock 2 years, most Kenyan children will have received more than 10 doses of vaccines to protect them from preventable diseases.
In our county, we have more than 10 antigens that we provide, and those are the vaccines that National Vaccine Immunization Program have introduced in the whole county.
The pandemic may feel like a distant memory, but its aftershocks are far from over. In the quiet gaps, a different story is unfolding, affecting the world's most vulnerable. Among those left behind in the rush to return to normal are millions of children who have not received even a single vaccine. They are known as the zero-dose children. But it's not just their lives at risk. When these children remain unvaccinated, it creates pockets where dangerous diseases can thrive and endanger entire communities.
Kazi yangu kwa community ni kuangalia haswa nikitembea kwa maboma za watu, ni kuangalia vitabu za watoto za kliniki. Kama kuna mtoto hajamaliza kliniki, ninamrefer kwa hospitali.
Immunization can prevent a wide range of infectious diseases, including tuberculosis, measles, mumps, rubella, polio, tetanus, rotavirus and yellow fever, among others.
Every child who has been born and is within 1 year should be able to get all the vaccines available.
Urgent action is needed to ensure these zero-dose children and those who have missed out on vaccination are reached and immunized.
Africa, 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 tutapona.